Welcome to PHI, Public Health Impact. I'm Phaedra Corso.
And I'm Cham Dallas, and today we're going to talk with faculty from the Department of Health Policy and Management, of which Dr. Corso and I are both members, and Dr. Corso is our department head.
We're also going to be talking to several of our students about healthcare reform, which is one of the leading topics in the health policy field right now. And we're going to be asking our students about what they think about the legislation that was passed earlier this year, and also their thoughts about the future.
Health policy and management is a unique field. It's very multidisciplinary, many different disciplines in one field, such as medicine and economics.
We also have faculty expertise in psychology, sociology, and health services research.
And business and public policy.
Well, you know, there's really no better time than to be in the field of health policy, given all of the changes that we're currently talking about in our healthcare system.
Well, why are we talking about all these changes now?
Yeah, I mean, I really think the driver here is that we have unsustainable growth in healthcare costs. We have too many people who are uninsured, and we have major access and quality of care issues.
Of course, healthcare does cost a lot here in this country, and yet if you compare us with other countries, it's hard to say we're really getting more for our money.
That is very true, especially relative to other countries that have entirely different systems than our own, are seeing better health outcomes than what we have here.
So join us for this discussion of health policy and management and this very timely topic of healthcare reform.
We're now being joined by Dr. Monica Gahn, who is an assistant professor in the Department of Health Policy and Management. Monica, what is the field of health policy all about?
Health policy affects 17% of the U.S. national economy. We spend a lot on health care. So health policy are the rules, the regulations, the procedures that governments put in place that help us understand how this whole system works. Health policy is interested in things like fairness, whether or not healthcare actually works, the quality of interventions, how much they cost. It's very complicated.
This is an obvious question, but what is of most relevance right now in the field of health policy?
Earlier this year, the U.S. Congress passed the Patient Protection and Affordable Care Act, which was signed into law by President Obama. At this point, we're in the implementation phase of that legislation.
Well, Cham and I talked earlier about why healthcare reform discussions have been going on in the last couple of years, and we really identified three key areas, one of them being unsustainable growth in medical care costs, lack of insurance for many Americans, and also quality of care and access issues. In your opinion, what part does the legislation that was passed earlier this year, what part does it impact the most of those three key areas?
Well, certainly the earliest benefits will be increasing access to health insurance. About 32 million Americans will have access to health insurance who do not currently have it.
Well, can you explain to me a little bit about how health insurance actually works?
Sure. No one wants to get sick, but we don't know when we're going to get sick or how sick we're going to be when we get sick. So health insurance is a way for us to financially protect ourselves against that risk of some unknown event in the future, very similar to the way car insurance or fire insurance might work. These are not things anybody wants to happen to them, but they do. And so insurance gives us an opportunity to help protect ourselves from financial loss.
But why is it important for everyone to have health insurance?
Everyone needs to have health insurance because it allows us to pay into the same big pool. Again, no one is planning to get sick next year, but if we're all paying in, then those of us who do get sick will have adequate coverage, and those who do not get sick can be happy because they didn't get sick, but they will still have insurance for that future time when they may in fact be sick themselves.
Well, can you tell me a little bit about the health insurance coverage here in the state of Georgia?
Sure. Georgia is a lot like the nation in terms of the distribution of health insurance. About half, 52% of Georgians receive their health insurance through their employers, and the other half get it either through public insurance or are uninsured. In fact, 1 in 5 Georgians is uninsured.
And with healthcare reform legislation passed, which of these health insurance groups, public or private, should expect to be impacted the most here in Georgia?
Well, first, we should expect pretty low impact among the population that's already covered by their employers. There'll be very little change going on with people who already have employer-provided health insurance. The same is true for people who are in the Medicare and the Medicaid system. The biggest change is going to be for those individuals, the 1 in 20 who don't have insurance, or the 4% of Georgians who have to purchase health insurance on the individual insurance market.
Well, that's given us a good handle on what the insurance market is all about. Coming up in the show, we'll be talking about the healthcare reform legislation itself, some of the components that have already been implemented, and what we should expect in the future. We're now back with Dr. Monica Gahn. Monica, let's talk about the nitty-gritty details of the legislation. What are the main components?
I perceive 4 major parts of this legislation. One is the individual mandate. The second are state-based health insurance exchanges. The third is Medicaid expansion. And the fourth is increased regulation of health insurance practices.
Well, let's talk about the individual mandate first. I know this is where a lot of states are having some problems putting forward a lawsuit about the individual mandate. What does that mean, an individual mandate?
Sure. Well, this is really the newest, biggest idea in healthcare reform, and it is that every American will be required to purchase health insurance for himself and his family in 2014. This has not been a rule before in the United States.
And if they don't, they get a penalty.
Exactly. However, there will also be some generous subsidies to assist families of lower income in purchasing health insurance.
And I imagine the intent behind that individual mandate was, as you said before, to increase that insurance pool.
Absolutely. The more people who are insured in the system, the more the risks and the costs will be spread across a larger population.
Well, let's talk about one of the other major components, one of the new components of this healthcare reform legislation, and that is the state-based health exchanges. What does that mean?
That's another very new idea component of this national reform. It has been tried in some other states, but the basic idea is that each state will be responsible for setting up a health insurance exchange or health insurance marketplace, one for individuals and one for small businesses. These small businesses and individuals will then join a large pool of people within their state that then are purchasing health insurance from insurers that are operating within that exchange marketplace.
And what's happening in the state of Georgia right now around the state health exchange?
Well, like many states, Georgia is trying to decide how to design it and to implement it. It's just too soon to tell how Georgia will address that particular problem.
And of all these pieces of legislation, I know some have already taken effect this year. What are some of those components?
Well, the way I like to think about healthcare reform is that it's being implemented over a period of 4 years between now and 2014. And we're starting with some of the easier fixes. And then as we get closer to 2014, we'll have more difficult ones to implement, such as that individual mandate and the health insurance exchanges. But some fairly easy fixes right now, for example, will allow all children under the age of 26 to continue on their health insurance plan of their parents. This is a big change, and it's fairly easy to implement because health insurance companies know how to insure children. Another major change is the coverage of pre-existing condition for children under the age of 19. So now, if parents are trying to insure their children who have a known health condition, they will be able to purchase health insurance that covers that health insurance condition.
Well, thank you. I think that gives us an idea that we really need to be watching this legislation over the next couple of years.
It was my pleasure.
Well, you know, this is such a hot topic. Everybody has an opinion. And so we'll be talking to a few students next. And we're first going to be asking them, what do they think about the legislation that was passed earlier this year?
I think the legislation should be kept as is. Right now, it's got a great point behind it. It's trying to increase access to all Americans that are eligible for it. And so I think it's a great idea and it's got a great concept. There may be a little bit of tweaking that can be done to it, but not necessarily a major reform or definitely not repealing it.
I think the legislation should be repealed. Part of the issue is that with something like an individual mandate, enforcing everyone to have insurance just simply isn't constitutional. And I think the fact that the Democrats basically just forced this issue through without trying to form any sort of bipartisan anything is not good for legislation this large that will affect the country. So I think it needs to be repealed and redone in more of a bipartisan format, which requires the Republicans to come on board and listening to the Democrat side and the Democrats to listen to the Republican side.
Honestly, it's been so much time since I've given any thought to the legislation and all the intricacies of what was passed that I honestly don't think that I have a valid opinion on whether it should be repealed, reformed, or kept the same.
Well, realistically, I think there is room for a little bit of reform here or there. I think it's important to get it financed and get the ball rolling because it's been such a long, drawn-out process. I think it's important to accept the fact that there's going to be some small failures. Not everything's going to roll out as smoothly as it's written on paper. Accept that, show some progress, and show that this really is for the betterment of everyone else.
I'm in favor of keeping it as is. I think over time, because it does take a while to implement everything that's in the law, over time we're going to see what needs to improve and what needs to change and what needs to be eliminated. So as is for right now, definitely.
I like it as it is, but I would love to see some more improvements to happen on it. I like the fact that it's very sort of uniquely American because it's not modified after a specific European model. It's, for example, one of the things I really like is the fact that you can stay in your current insurance company or you can buy into the government pool. And if you stay in your insurance company, you get a tax benefit and whatnot.